the only one taking control.
So okay, we have list here, and first there is patience. You must have it, because everything ain't going to happen fast. The progress is usually slow.
And the ability to relate. Eija must sometimes say that we can't tell somebody to do that if we haven't done it ourselves, so we have to experience some kind of thing that we can relate them.
About the emotion managing, we already talked about when we might be feeling frustrated because the client just didn't progress as we were expecting, but we have to manage it and keep the client motivated and keep ourselves motivated as well.
And teamwork, if you are thinking, for example, rehabilitation, you need to work with your client and with the other professionals.
Organizing, it can be simple as organizing your schedule and doing things in order, not being chaotic.
And we have to set smart and realistic goals, and it isn't that easy what it look like, so
Taking responsibility.
Yeah, we have the responsibility on the client's rehabilitation. We have to like plan it so that, yeah, like we think about the goals when we are like planning, I don't know, like, I don't know what to say. Think about the risks, think about the goals, and plan it so that it matches with the client's own goals too.
And sometimes if you don't agree with someone, at least you have to listen her or him and value his or her opinions.
and we have to create different kind of activities and also be able to adapt them to the environment, and if for instance the client is tired, so we have to adapt and do something else. And
Risk analyzing, we talked about talking to like with the nurses and the doctors, so that we can well analyze what the patient is able to do, and don't overdo it, so that the client is not won't be worse after you do it.
And seeking help, you need to understand you can't do anything, so you need to seek help somewhere.
And last one is appreciating small things. Duarte had a good talk about that.
Usually when the client comes to us, it's because he lost something that it's really important in their lives, so they need our help. And it's our mission to work on their motivation and help them to find those really small things that they still are able to do, give them motive to keep on working. And usually when they come to therapy, they can see other therapists working with different patients, and they get curious, they ask, they feel emotions between other patients. So it's really important to make them experience what it's like to appreciate the smallest things. For example, everything is a victory for the patient. it's not a victory for us that we make them feel better, but for the patient. And that's the most important thing that we need to realize.